So go to next slide. So for those who are new to Norwalk Acts, we are a collective impact partnership and a place-based partnership here in Norwalk that brings people together in organizations and systems in a structured way around common goals to achieve social change. So our theory is that no single organization or entity alone can create lasting social change. And so our focus today is really about bringing partners together to achieve kind of early childhood development at the key kind of milestones. So we can go to next slide. So Norwalk acts as a cradle to career group. We have three different initiatives that span kind of this cradle to career continuum. We have an early childhood development initiative, a social emotional health initiative, and then college and workforce readiness. And so on the outside, you can see our cornerstones, our work. What we describe our cornerstones are the key ingredients to making the initiatives um, have the ability to move the needle and the outcome in those areas. So our four cornerstones are around data, policy and advocacy, community engagement, and social justice and racial equity. And so we work as a backbone staff for Norwalk Acts to incorporate these cornerstones in the different initiatives. So an example today from our Lunch and Learn is really around that data cornerstone as it relates to the early childhood development initiative. So, by the way, I'm the deputy director for Norwalk Acts, but MJ Corona is our manager of the Early Childhood Development Initiative. She texted me this morning that she has the flu, so we're all hoping she feels better before the holidays. I think it's better to get it now than next week. So I'm stepping in, but I am not the early childhood development master at this point. So I know there's a few folks on this call from our initiative and our leadership team that can chime in if there are questions that I can't answer. But just to give a little background around our initiative, we have this initiative. It consists of mostly community members and cross-sector partners. And we have kind of four goals. One is to improve the coordination of services across all early child professionals and agencies. The second is really implementing a community-wide system using the ASQ for screening, tracking, and promoting development. The third is creating and maintaining a partnership between families and early childhood educators and providers. And the fourth is providing outreach to families in a manner that is sensitive to their language and culture and sharing the resources and support. So this is a visual representation of what our work is involved with that second goal. Basically, these are all the different partners and pieces of Norwalk and the state that are connected to the Ages and Stages questionnaire. And so the big bubble on the left are all the different early childhood providers that use the Ages and Stages questionnaire here in Norwalk. They consist of state-funded programs, school readiness and child daycare, contracted programs, Head Start, family child care programs, and so forth. We also have a close partnership with Norwalk Public Schools, where each student that registers for kindergarten conducts an ASQ. We've partnered with the healthcare sector and have partnerships with Norwalk Community Health Center and other partners listed here. The history of this initiative really started in 2011 with a state local partnership involving United Way. And we have connections with OEC, the University of Hartford, which is one of our key partners today. And then there's the home visitors, such as Family Children's Agency. And then we make sure that all the different aspects of this initiative are out in the Norwalk community through community advocates. So that's that last bubble here. So the history of this initiative really started in 2011 through Norwalk 211 Child Development, and it was funded by the Grossman Family Foundation to United Way of Connecticut to really support state and local partnerships around Norwalk children entering kindergarten ready to learn. And the initial focus was with state-funded school readiness programs, but we have essentially scaled that from 2013. My screen is a little blotchy, so I can't see everything. We've essentially scaled that program to reach more providers than just the state-funded school readiness programs in 2023. So we kind of did a handoff over the past bulk of these years from United Way into Norwalk Acts, leading this initiative closely with our partners such as Family Children's Agency, the Norwalk's Office of Early Childhood, and other key partners such as Norwalk Public Schools. And our key goal is to scale the work of the ASQ and make sure that families are getting connected to supports and resources, and that we're communicating and coordinating at a local level to increase the number of screenings, the quality of interventions, and making sure that children are on track to developmentally learn by kindergarten. We can go to next slide. Part of our initiative includes a data quality work group, and the key researchers in that work group are the University of Hartford and their Center for Social Research, and they help with technical assistance. And we have created a kind of scope of work and partnership that help fund that Center for Social Research project around what is the research that connects the ASQ to the various assessments that the school system uses, and how does it connect, and what does that mean for us? And so, um, just a quick kind of short lead into the presentation. The research from today that you'll hear really validates that our early childhood development initiative is a model for screening, tracking, and promoting young children's development, and it could be implemented across the state and the country as a successful model. And I'm really excited to kind of turn it over to Wes, and I think Marcia might be here as well to share what the details of that research mean for Norwalk.
Right. Thank you, Jesse. And I imagine that others are seeing some blocks on their screen covering some of the slide information. Um, Brendan, I had sent you a quick private message. You might want to stop sharing and try resharing again, see if that clears it up. And it looks like it did. If you could go back, okay, perfect. So thank you all. Appreciate your time today. We'll talk a little bit about the analysis that we've done with data that's been collected by Norwalk Acts and partners over the past 6 years in particular, but this is, as Jesse mentioned, been going on for quite some time longer. And we're really excited about not only the results of our analysis, but also the data infrastructure that has been developed in collaboration with Norwalk Acts, University of Hartford, and several other partners in the community for collecting ASQ screening results and linking that up to data from Norwalk Public Schools in particular, focused on kindergarten readiness and academic progression in terms of proficiency in reading, math, and English language arts through grade 3. First of all, we want to talk a little bit about the sample that we're looking at for this analysis. There were about 3,600 students who enrolled in kindergarten in Norwalk between 2018 and 2023, and that had been assessed by a parent or caregiver on the ASQ3 at the time of kindergarten enrollment. So that's our starting point. For those students, they also have been assessed within the first 6 weeks approximately of kindergarten on the teacher administered kindergarten entrance inventory. It's the state developed and required assessment of readiness for kindergarten. And then for two of the cohorts, we comprising about 1,096 students, we have third grade reading, English language arts, and math assessments. And the English language arts and math assessments are the state required SBAC tests. The third grade reading is assessed through the DIBELS assessment. So we have data on just over 1,000 students through grade 3 that includes ASQ, KEI, and the 3 third grade assessments. In terms of the kind of demographics of this sample, 35% of the students were under age 5 at the start of kindergarten. This is obviously a a point that we want to keep track of moving forward, given changes in state policy regarding age at entry of kindergarten. So about two-thirds were five or older. About a third, a little more than a third, were under five at the start of kindergarten. In terms of race, 52% of the students in our sample identified as Hispanic with any race listed. 28% were white, 11% black, 6% multiracial, and 3% Asian. Um, about 23% of our students in this sample were identified in the system as multilingual learners. About 50% were identified as residing in one of nine contiguous neighborhoods in the south central area of Norwalk that we had identified in our earlier neighborhood profiles report as living in areas with high concentrations of childhood poverty and low income. And finally, in terms of preschool attendance and experience, about 59% of our sample had attended publicly funded preschool. These are the Head Start and school readiness programs. 29% had attended a privately funded or family-run preschool, and about 12% said that they did not attend any preschool or that their children hadn't. So we want to start off. I'm going to try to just walk you through some of the key results. I'll highlight the things that we need, but feel free to look at the graphical depictions of the results. So just starting on the right-hand side of your screen in our graph, what we've done here is we've broken up all the results into two groups based on their ASQ screening at the time of kindergarten enrollment. So it was the most recent screening prior to kindergarten. On the left-hand side of each graph, you'll see those students who, based on the parent ASQ, were rated as above or monitoring on all five domains. If they were rated as below standard for their developmental stage on any of those five domains, then they'll be broken off and appear on the right-hand side of the graph. The reason we're doing that is we want to compare those students who are above or monitoring, essentially on track or moving towards being on track in terms of the developmental stage and development at that stage, versus those that are showing signs of potential delay or otherwise needing additional supports to get up to the place we want to see them at in terms of school readiness and being able to progress and achieve that we like. For the colored bars, you'll see the blue are for the kindergarten proficiency. This is the KEI administered by teachers typically in October of each school year with students that have been in the classroom for about 4 to 6 weeks. Those of you familiar with the KEI, it is a homegrown Connecticut-based assessment tool designed by the State Department of Education with teachers and other early childhood experts, focus on those core academic and social skills that were deemed necessary for success and readiness for public school. The orange bars represent third grade DIBELS reading assessment results. The percentages for KEI, just to step back real quick, will always show the percentage who are in either level 2 or 3, meaning that they're either they're consistently displaying the skills expected of kindergartners, or they're nearing that and just not consistent yet. The percentage that's left out, so 67% of our above and monitoring students met those criteria across the 6 domains. The other 33% that it is not shown in the bar are students who on one or more of the domains on the KEI had the teacher had indicated that they need substantial support. For the DIBELS, these are students who are at standard or above. So those that are well below benchmark or below benchmark would be the 33% that you don't see in the orange bar on your left. For the gray bars, this is third grade English language arts proficiency measured on the SBAC test, completed typically in March of every year, March to April. So these tests are standardized tests given to every student in the state. And there are four levels of performance. What you see here is the percentage of students who achieved at grade level or above, exceeded that. For the yellow or gold bars on your screen, these are for the math proficiency tests. Again, the percentage you see are those that achieved at standard or above, exceeded standard. So, in looking at these graphs and what they show you, first of all, compare similar color bars from the ASQ monitoring group to the ASQ below group. So, the two blue bars on your screen. And what you see very clearly is that those students who are above or monitoring on all domains of the ASQ were about 2.5 times more likely to also be considered proficient or as either nearing or at their readiness standards for the KEI. This is important because it shows that parents who have had substantial time with their child up to this point, who are rating them in terms of development on the ASQ, and then kindergarten teachers who've had substantially less time, 4 to 6 weeks with the child, but have a standardized behavior-based assessment for readiness and need for support in kindergarten, are seeing very similar things. That success or readiness based on the ASQ developmentally is highly related to readiness based on teachers. So they're seeing very much the same things. In terms of the rest of the assessments, keep in mind that the DIBELS reading assessment, the ELA and math assessments are all conducted in third grade. So they're substantially down the road from when the ASQ and KEI results were obtained. And this gives us a good picture of how much developmental readiness and then kindergarten readiness can impact later achievement in school. So comparing the orange for the above group to the orange for the below group, you can see it's about 1.7 times more likely that the above group will achieve at or above the benchmark on the DIBELS than the below group. For the above or monitoring group on English language arts, the gray bar on your left, 41% had also achieved at or above the standard for third grade English language arts, compared to only 13% of those who were below on one of the ASQ domains at kindergarten enrollment. And finally, for math, you see the 47% who are in the above or monitoring group who achieved at or above, above or monitoring on the ASQ at kindergarten enrollment. About 47% of those also achieved at or above standard on the math SBAC scores. And this is compared to only 17% of those who are below on one or more of the ASQ domains. So across the board, we see that youth who and children who are developmentally on track or approaching being on track at kindergarten enrollment are, first of all, more likely to be ready for kindergarten according to their teachers. They're going to be more likely to succeed in terms of reading, math, and English language arts in third grade according to standardized tests. And this is really validating, I think, for a lot of the work that's happening and been happening in Norwalk in trying to make ASQ assessments universal across all children in the community. And the fact that it's telling us something that we're also seeing when kids enter kindergarten and then as they progress up through third grade, it really validates that effort that it is picking up on things that are important. We'll talk a little bit after I show you some more results about the next steps because we have some additional questions that we're going to try to answer in the future. But I'm going to pause here and see if anyone has any questions about this first set of results, and then we're going to kind of dig into what we found for some important subgroups within the population.
Wes, I might chime in also for a quick moment. I realize we didn't clarify this in the beginning. So if anybody is not as familiar with this work, The ASQ is the Ages and Stages questionnaire. It's a parent completed screener that can start as soon as 1 month after a child is born up to 5.5 years. And it tracks developmental growth across 5 domains. So communication, gross motor, fine motor, problem solving, and personal and social. And so this is a parent completed screener. The data we're using for this is particularly the screener that's completed at a kindergarten registration, but it's how does this translate into academic indicators that schools use? And this research is, Wes has was going to highlight this, is really specific to Norwalk and hasn't really been completed before in this way around how strong it is a predictor for this. I just wanted to clarify for folks that were new what the ASQ is and how relevant it is to compare a parent completed screener to teacher completed or student based academic assessments in third grade.
Yeah. Thanks, Jesse. I appreciate that. Any other questions? Feel free to drop questions in the chat. I've got it up so I can also kind of monitor as we go, but I want to make sure that that first part is pretty clear with folks. Okay, you can go ahead and move to the next slide. We can always come back to questions as you digest. So what you'll see on the next few slides are breakdowns of the relationship between ASQ screening results at kindergarten entry or enrollment, sorry, and the four assessments broken down by different subgroups. And so the first set of subgroups are based on the multilingual learners versus non-multilingual learners. And we know that there are some challenges that are faced by students when English is not their native language, and especially when you get to some of the standardized testing that happens in third grade. So we wanted to take a look at the relationship between ASQ results and those assessments. The first thing I want to just point out is that there's clearly a difference in success rates for multi-language learner students versus non. And you can kind of get a sense of this by the percentages and just the overall height of the bars for the left-hand set of graphs versus the right-hand side. Non-multilingual learners generally do perform better on the standardized tests and assessments than multilingual learners. And that's a discrepancy that we would like, and an inequality we would like to see decreased over time. So that's something that we'll be looking into. But for now, we wanted to explore, well, what does the ASQ look like in relation to these assessments within each group? And do we see similar patterns? So on the left-hand side, you see the multilingual learners. And again, we do see that those who are in the above or monitoring group for the ASQ at enrollment do perform better in terms of kindergarten readiness, the blue bars, in terms of reading, the orange bars, in terms of ELA proficiency, the gray bars, and in terms of math proficiency, the yellow bars. So we see the same basic pattern that we saw for the overall sample for the multilingual learners. And if we look on the right-hand side of the screen with the non-multilingual learners, we see, again, the same basic pattern, that those who are above or monitoring on the ASQ are performing better on all four of the assessments than those who are rated as below on any one of the domains of the ASQ. This consistency of the relationship is important because it shows us that the ASQ is picking up on some very consistent, very universal aspects of development that are related to performance and readiness for school. And that's something that we wanted to see. And it's doing it for both of these subgroups. We would like to see these discrepancies, however, between the groups decrease, and we like to see them decrease over time. And that's something that we'll return to in some of our later work and later analysis. But for now, this definitely motivates the question and use of the ASQ screening for both subgroups. All right, next slide. This set of results breaks down the population of the sample into those who reside in the 9 high poverty or low income neighborhoods in Norwalk um, versus those in the more affluent neighborhoods in Norwalk. And again, looking just at the low income neighborhood students residing in low income neighborhoods, you see that those that are rated as above or monitoring on the ASQ are substantially more likely to succeed, be ready for kindergarten, and perform at or above standard in reading, English language arts, and math in third grade than those who were below on any one of those domains. The same pattern emerges for the affluent neighborhoods, but again, you can see that there is some leveling of some inequality in terms of affluent neighborhood environment versus a low-income neighborhood environment for overall achievement. And so we'd like to see those gaps decrease through this work. And we'll again be focusing on that in our next phases of analysis. But for now, we see basically the same pattern. There's going to be a few differences according to the different assessment tools, and there will be some differences across these subgroups. But again, we see the same basic pattern and effective results. The ASQ predicts success, and it's true for both groups. The last breakdown that we looked at for this analysis was based on preschool experience. We have three groups here. We have those that did not attend any preschool, those that attended a publicly funded preschool, including Head Start or school readiness, and those that attended a private or family-based preschool. Across the three graphs, you can see that overall there's students attending private and family-based preschool generally did better, performed better on the assessments than those who did not attend any preschool, and slightly better than those who attended the publicly funded preschool, which, by the way, keep in mind, about 60%, just under 60% of our sample attended publicly funded preschool programs. And we know that those tend to have a much higher diversity of students attending, whereas the private and family-based preschools tend to be located in the surrounding neighborhoods of Norwalk and those that are more affluent. So there's some overlap there with neighborhood poverty and income. And both groups did do pretty substantially better than those who had no preschool experience prior to enrollment. But within each of these groups, those that are in the above or monitoring perform better on all the assessments once again than those in the below group. And so you can see the bars for the above or monitoring tend to be 1 to 2 times higher than those in the below group for each of the subgroups. So again, we're seeing that the ASQ is predictive of kindergarten readiness and later third grade academic progress, regardless of the subgroup, although there are some interesting and important differences across these preschool experience subgroups that we'll continue to explore. And we want to talk about and think about our future analyses and what they could show us about narrowing some of these gaps. Next slide. All right, so quickly, I keep alluding to some of our future stuff, so I'm going to get there. Just to summarize, parent-completed ASQ results are predictive of kindergarten readiness and third grade academic progress. This is important because we've put so much effort into universal screening of youth and children in Norwalk up through kindergarten enrollment using the ASQ in multiple settings. And that's important because if it's something that isn't going to tell us about how ready a child is for kindergarten or their success in early grades, which we know are predictive of success in later grades and even graduation rates, then there's a question about, well, why are we doing it? Why is the ASQ so important to roll out for this young group? And the fact that it has these essentially within this context, fairly long-term association with academic readiness and progress, it really substantiates the effort. Um, there's another real important, two other really important points. First of all, the consistency of these results of the association of the ASQ with kindergarten readiness and third grade achievement across the different subgroups. And these are pretty varied subgroups. And they're subgroups that we know from both other work and our work in Norwalk tend to have different experiences and different achievement on state mandated assessments. That the pattern's the same, which really tells us that the ASQ is a tool we can utilize effectively for all of those subgroups. So it is a very useful universal tool for detecting and monitoring developmental challenges. The other thing that relates to that is that the ASQ provides a standard metric for aligning measurement of developmental progress across all of these contexts. And that is regardless of the parents or our family's resources. The ASQ is something that can be administered in multiple contexts and has been. So where do we see this going? There's two main things that we're going to be looking at in the next year. And this is only possible, I want to stress this, only possible because of the work that Norwalk Acts and partners have done to create a data infrastructure that can not only link one ASQ completed by a parent at kindergarten enrollment with third grade test scores, which is pretty monumental in and of itself, but to link ASQ um, assessment results from the very earliest assessment, which, as Jesse mentioned, could be within the first month after a child is born, all the way up to 5.5 years of age. The fact that Norwalk has built this longitudinal screening database is going to allow us to answer some really important and more nuanced questions. Uh, One is whether participating in multiple ASQ3 screenings. This initiative over especially the past 6 years has really ramped up the coverage of ASQ screenings across the community, not just at kindergarten enrollment. And so what we want to see is that those kids who are getting screened multiple times over the course of their early years, how are they doing? Because the ASQ is not just it's not a measurement tool, it's a screening tool that's designed to monitor and track development, identify when there are issues present, and then be used to see how things are progressing. It is itself an intervention. And those of us who have seen the ASQ administered in real time on the ground have seen the kinds of conversations that it sparks between, for instance, parents and providers or teachers. And this is a really useful thing in and of itself. So we want to see if multiple screens is associated with these later results and the discrepancies across the subgroups that we've highlighted here today. The second type of analysis that we're really gearing towards is looking at the effectiveness and impact of the tiered interventions that have been tied to ASQ screenings. And this is a smaller subgroup of students who've been screened. And so we're going to hone in on a few of the groups that have the most time implementing a tiered intervention system and have the clear, kind of cleanest data on those youth to see if the tiered interventions themselves, on top of repeated screenings, has an impact on kindergarten readiness and then third grade assessment scores. There's some other nuanced analyses that we'll be conducting to ensure that our interpretation of the results and is accurate and that we're not missing any hidden sources of variability, breaking down the results on the different assessments into the smaller categories that we collapsed for this first round, and doing some other types of modeling techniques just to make sure that we've exhausted the information and the data. But Really, that's the main thing. I see there's some questions in the chat. I'm going to address those. So as you're kind of digesting all that, I'm going to try to answer. And then if you have other questions, please raise them. First of all, Mary, thank you for your question. You said on slide 13, and maybe you can go back. Thanks. Can you define private family preschool? Does this include home-based family childcare? That's a great question. I'm going to actually open that up to maybe Paula can read in. My understanding is that that does include the family preschool does include the home-based family childcare as long as it's noted in the system. Is that correct?
Yeah, I'll speak to that. So the choices that a parent has when they register for kindergarten is one of the choices is my child attended a licensed family daycare. So they didn't that there's not more it's not more specific than that. So we group them in with the privates. There was only one child whose parents said my child was cared for by a family member or a friend. So, kind of not sure how to whether that's did not attend preschool or is, lumped in with private, but it's based on the choices that they have in the registration.
Thanks, Paula. And there's always going to be a little bit of error, a little bit of give and take with some of the data. However, this is really, I have to stress, really clean and clear data. We have to keep in mind what it's based on. It's based on information that families provide at enrollment. Second question you have here is, are we really saying that the multiple measures of ASQ are changing things, or that the multiple measures are tied to a family having contact with someone who's connecting them with services? That's really the question we want to try to answer with our follow-up analyses. And there are essentially those two possibilities. There is something to regular contact assessment, monitoring, and tracking of a child's development that could have an impact as we're paying attention, not because that there's nothing else happening, but because there is stuff happening. But it might not be the kinds of interventions that we have in a formal tiered intervention tracking model. So that's a larger subgroup of our sample that we won't have tiered intervention data on, but that we know that there's multiple screenings. So there's, first of all, is there an impact of having multiple screenings, multiple conversations, monitoring and tracking intentional attention to a child's development? Does that have an impact? And then the second question is, are we, making an impact with these more targeted tiered interventions that are in place for students that and children that have an identified delay or challenge in terms of their development? Um, Manisha, thank you for your question. And I'll get back to Mary's third question, but I want to give Manisha an answer. Are we to understand from the trends across all the graphs that SBAC ELA is less effective at measuring readiness than DIBELS? No. They measure different things. They're measured in different ways. The DIBELS is measured through short fluency assessments that teachers do throughout a period of time in third grade, whereas the English Language Arts SBAC test is a one-time sitting in which the student completes not just reading-based, but also other language-based assessments. So they're measuring different things, measure them in different ways. I would not say that one is better than the other at measuring readiness. What we do see, what I can say about the data is that we do tend to see that more students achieve benchmark or above for the DIBELS than students achieve meeting or exceeding the standard on the SBAC. So from a kind of a measurement standpoint, the SBAC English Language Arts version is a harder test. There's less success at it. having said that, it doesn't mean that it's not as good of a measure as the dibbles. It's just measuring different things. Um, the last question about discrepancies in the result from Mary is you might want to dig deeper on how people are answering that question, or I think that's in reference to the question regarding preschool experience. And I think, Jennifer and formerly Maria and Paula and the data team, we go through those data sources on a pretty regular basis and discuss those. So we can dig deeper a little bit. But as Paula mentioned, um, it's pretty clear in the vast majority of cases whether a student attended a publicly funded preschool program, whether they attend, and they're not saying it's publicly funded. When they select, they're selecting from a variety of different preschool names or site names that they would recognize, and they often and they can type in provide or write in their own name for it. We do a lot of cleanup on the back end to match up those names and then collapse them into the categories. So um, I don't want to give the impression that families have to decide, oh, this was publicly funded or this was privately funded. They're acknowledging, where did my kid go for preschool? And that's something that they're much more um, able to answer. Um,
Can I speak to that a little bit?
yes.
As we dig down into that, they when they say my child attended um, a licensed family daycare, it's usually because it's not on the list, and they will add something about a daycare that is we don't even know where it is. It's out of country, it's out of state. So that's kind of the catch-all for the non-recognized Norwalk in the surrounding area preschools. So we do have that information, but it comes in separate fields.
It is a varied group. I'd say, based on what I've seen, the Head Start school readiness group is really clear. Where they went. The 12% that didn't attend preschool, that's pretty clear. They are reporting that their child didn't go to any. And then that 29% privately funded family based, that is, as Paul is referring, is kind of a catch-all for the rest who had some kind of experience, but it's unclear what it is. That's going to be a much more wide or diverse kind of experiences in our, what we see. However, because some of them are really recognizable providers in Norwalk, we do know that many of them are, um, you know, uh, located in that kind of peripheral area of the city. All right. Was there a group that didn't do an ASQ, but and this is from Catherine, but who had a pre-K experience and took the other assessments that the ASQ groups were compared against? We're not comparing those who have an ASQ versus those that did not in this data set. We only have those in this current data set that have completed an ASQ, but we do have a non-ASQ data set as well that we'll be looking at, right? Paula, anything you want to say on that?
Yeah, just that, at the kindergarten registration, it's mandatory that they do the ASQ, but there's always some children that kind of slip through and get entered into kindergarten. It's a moving target because the registration starts in February of the year before they start kindergarten, and it goes all the way up until, and I usually capture everybody that registers up through September. So again, it's a changing landscape because it changes every day as new children are registered. So it's we're capturing it as best we can, and relying on that to be as accurate as possible. But again, this is filling out an online registration for Norwalk Public Schools, and we're just capturing that data as best we can. And the paper ASQ no for the kindergarten registration is done online. There's a link in the online registration that takes them right to Brooks Publishing, and they fill out the ASQ online, and then we download that data. So again, there's so many ways we could dig deeper because again, if a child is taking the ASQ in February or March, there's a big difference between that the 6 months leading up to school that may indicate a different set of results. They may have 6 more months of intervention or 6 more months of development that just happens organically or with preschool. So again, it's the ability to dive deeper into that. There's an awful lot of work that would have to be done. But I think as we continue to do this, we're learning things. And the fact that the trends are similar in every instance kind of tells us we're on the right track of being able to see what's happening. Does that answer questions?
I think that's the last one I see. Any other questions from the audience? You want to drop them in the chat or come off mute? So the concern about the differences across preschool experience is that, the possibility that family or privately funded preschool experience is, providing a better result. And definitely understand that. It's similar with some of the other subgroup analyses. We don't want to, this isn't a competition. We're really looking at these different contexts first in this case to see, you know, how effective is the ASQ? Is it universally effective as a screening tool and predictive as a screening tool for later success? And we're seeing those results that yes, it is, you know, associated with these other important outcomes across all these different groups. So we want to keep doing the ASQ across these groups. That's the first thing. Um, then we want to think about, as we start digging in and looking at the impact of multiple um, screening on results, and then looking at tiered interventions, which again focuses in on even a more specific group, a narrower group. As we start doing that, we want to see what impact are these interventions and these screenings having on the discrepancies, because I think our goal would be, at least I would argue, would be to decrease discrepancies based on neighborhood of residence, based on language, based on preschool experience. We don't want to exacerbate them. So if the ASQ is picking up on something universally, can be used universally, then we should do that. And then we should look to see what is happening within these subgroups as we continue the continual monitoring and tracking, and then tiered interventions. And does that reduce the discrepancies that we might see? I think that's our goal. So we'll be digging that in, or digging into that. Let's see. Was an ASQ done prior to the child starting pre-K, then prior to K? In some cases, yes, but not in this analysis. This just looks at the ASQ that was conducted at enrollment or prior to enrollment in kindergarten, so it's the most recent. We'll be looking at the prior ASQ results for children, which varies a great deal from child to child, how many times they've been screened. But we see for the later classes in this data set, there's more that have had multiple screenings because that effort has increased over the years. Let's see. Do you anticipate eventually your research may suggest retiring some of the other assessment tools? No, I don't. And I have a love-hate relationship with standardized assessments. I mean, I think all parents do. I think all students do. I think all educators do. We know that they tell us some things, but they leave out other things. None of these is perfect, and because of that, my approach if we think of it straight from a measurement standpoint, all measures are fallible, they're imperfect, they contain error, and they hopefully don't contain bias, but we know that they do have some. So it's better for us to have a holistic picture of a child's development and a child's progress, academically. And so I would argue that more assessments are tend to be better. We see that a child is not maybe meeting a standard on one test, but is in others. It gives us that much more information to build supports around them and to determine, really is it a targeted intervention strategy that needs to happen, for instance, in the school system with resource teachers and extra resource help, or is it something where it's really a test effect? And so I would say no, we're not looking to abandon any other assessments. I think that would be a mistake at this point. Can we improve some of the assessments? I'm sure they can all be improved. That's something we learn from data and move on. Um, Keep in mind, we did not develop any of these. These were all assessments that were either developed and validated, by others outside of our work in Norwalk and are used elsewhere, or by the state and that are mandate. And so they're used whether we like them or not, and we would like to be able to see our students succeed as much as possible on those.
We have time for about one to two more questions. There's been a bunch of questions in the chat, but if anybody wants to come off mute, feel free to ask that way.
We'd be sending out the PowerPoint or data brief to participants. I think that's a
Yes,
yes.
we will be sending that out.
Jesse, or do you or anyone on the team want to hit that last slide or?
Yep. Yeah, we'll wrap up and conclude now. So just want to thank everybody for coming during a Monday at lunch to listen to About Data for an hour. Really a big shout out to Wes and Marcia and our partners at University of Hartford Center for Social Research. We're really grateful for the partnership with them and to have our work validated with research to know that it's working. I recognized earlier Representative Dathan, but also want to recognize Representative Dominique Johnson for joining us. And it's just, we really appreciate having our local legislators here to also listen in on this data as well. So we will be sending out the data brief and the PowerPoint. This isn't the last of these conversations as well. As you can see, we have another year scope of work mapped out. So we're excited to bring folks back together to talk about more updates on that. The last thing I'd like to just highlight is a more of a Norwalk Acts piece. If you are familiar with our work, we have an MOA, a memorandum of agreement. We just redid it. So we're asking folks who want to learn more about Norwalk Acts or want to find a way to get involved. The best way is to really sign that MOA. We're asking all organizations that maybe have been members in the past to re-sign this MOA. So if you're new, you can scan this QR code or look at our website and join. If you're working for an organization that you think should be a member of Norwalk Acts or was previously, but you don't know if they are now, I would encourage your CEO or executive director to sign on behalf of the organization, and they can designate staff to the different areas of our work, such as early childhood development for today or data. And then if you're just here as a community member, or if you interact with Norwalk Acts on more of an individual basis, we also encourage you to sign the MOA as that. And so we'll just leave this up here with the QR code. And feel free to reach out if you have any further questions or things that didn't get answered. And thank you once again. Hope you all have a wonderful holiday coming up.
And thank you everyone for the outstanding questions. It's always nice to have a data conversation with folks who have data curiosity and great ideas.
All right, we can pause the recording, Brandon. I don't know if you're able to do that or not.